I'm Charles Elder, and I study Complementary and Integrative Medicine at the Kaiser Permanente Center for Health Research. I was a full-time primary care physician practicing conventional medicine for 7 or 8 years, but with time I became a little bit frustrated with my job because I found that the conventional medicine model was too narrow for primary care. Over the years, I had familiarized myself with some complementary and integrative medicine modalities and systems, and I sent a proposal to the leadership of primary care suggesting that we pilot some of these complementary approaches to see if our patients would get better results and if we could have improved patient satisfaction. Patients really liked it, and over time, that part of my practice grew and grew, such that now it's become a considerable part of my practice. Overeating at night is really bad news. I have a referral-based natural health clinic, which is based upon Ayurveda. And at that clinic, I teach them some basic concepts of self-care, diet, daily routine, stress management, exercise, and so on. There are people who may have, say, chronic abdominal pain and may have been to multiple specialists and have had multiple procedures, and they come to our clinic and learn some very simple dietary prescriptions which enable them to improve quite a bit. But to really apply these on a larger scale in our healthcare system, we really needed more data. In managing chronic musculoskeletal pain, it's common to prescribe long-acting opioids on an ongoing basis, but there really is no evidence to suggest that it works, and in fact, there's plenty of evidence to suggest that it's harmful. On the other hand, acupuncture has been shown effective and yet is greatly underutilized by our system. I think complementary and integrative medicine is becoming more accepted, and one of the things that we can help accomplish by doing research in this area is to help us to understand which of these approaches are most effective and are most appropriate for integration. People are surprised when they learn that I spend 2 hours every day with a meditation practice. And people wonder how I find the time, but the fact of the matter is that when I meditate, then the rest of the day I'm much more focused and effective, and I get a lot more done than I would if I skipped that practice.